Hi guys, so I'm back with Pieterse, a registered dietitian who's helping me navigate my DNA analysis report. And this week we're going to look at inflammation. Over to you, Jace.
Thanks, Nicola. So inflammation is a term that maybe a few of you have actually heard of before. So why are we looking at inflammation in terms of genetics? So first of all, what is inflammation? We are trying to look at something called chronic low-grade inflammation, but it's helpful to think of it like this. If you're outside and you cut your hand, it becomes red, swollen, quite angry, and quite agitated. That's the body's normal response trying to heal and protect itself. A large part of that is the inflammatory response. But now can you imagine an angry type of response inside your body around your organs all the time? It's not the way that your body likes to function. So we don't really like inflammation. It can cause a lot of problems. We see when there's more inflammation, there can be more weight problems. There is often a lot of heart-related concerns. They can even, for some individuals, they struggle with their joints, sometimes even some gut complications. So really quite a broad area. Now, it's quite interesting that your genetics can actually influence, are you more likely to be in this inflamed state or not? So what we can see when we actually look at Nicola's results, there's two different sections. They're called the IL-1 and the IL-6 for her. She had a higher risk there, where if there's for some reason a cause for her body to make a little bit of inflammation, maybe it was a weekend, she had lots of wine, lots of birthday cake, something like that, and there was a trigger for inflammation to be made. She doesn't just make a little bit of inflammation, she makes quite a lot, and of those two particular types, or they're called inflammation markers. So her body's just in a bit of overdrive, potentially, in those two areas. So she's at high risk of being in an inflamed state. So what should we do now that we understand these genetics and the risks? Is we should try and do whatever we can to reduce anything that is in your lifestyle that's causing inflammation, such as having a high sugar intake, having lots of alcohol, things like that, as well as incorporating nutrients and choices where we are trying to lower the existing inflammation. And one of the best nutrients for that is something called your omega-3 fats, and that is your salmon, your trout, your sardines, pilchards, amongst others, which really helps to try and lower that inflammation.